if you balance your hormones to a more youthful level that's natural to the body with bioidentical forms, like so the testosterone, the estrogen, and the progesterone matches what your body produces, and you balance that, how is that hurting the body? How does that hurt the body? It doesn't hurt the body. It makes it function the way it's supposed to.
Right. Hey, my name is Jessica Goins, and I'm a nurse practitioner and owner of Optum Life Health in Dallas, North Carolina. And here with me is my husband, Bradley Goins, and together we own Goins Strong Fitness in Dallas and Cherryville. And today we're going to talk a little bit about hormone therapy for men and women, and kind of what that looks like and when you would consider it. So I guess I have to start.
You're the expert.
I don't know about that, but
You're the medical professional. I'm a dude.
so I guess I'll just say, typically, I guess nowadays with our stress level, what we're exposed to, we're always on the go. I don't think that we eat as clean as we used to, all those things. Our hormones really take a big hit. And so I see, especially a lot of firemen, police, that line of work really takes a hit, and either sex. So it could be early 20s, 30s, or whatever. Typically, testosterone in men and women, the levels start to decline, I would say for sure in the 30s.
Oh, yeah.
Yeah, for sure.
By mid-30s, for sure. For most people, there's some decline, if not outright dropped a lot.
You know, the men is the one who would predominantly get treatment.
Almost exclusively in the traditional field.
Not necessarily by primary care, sometimes by primary care, sometimes by urology, sometimes just to go to like a men's hormone clinic. For sure by their 40s, you know, for sure, you know, 50s.
Yeah.
This just depends, honestly. I mean, I have seen men who are in their 50s, 60s, who have a very nice testosterone level, and they still feel good and have other things. But,
right.
you know, if you're a man and you're going around like really tired, you could be even depressed, low libido, maybe even erectile dysfunction. There's a lot of problems, right? You've got to get those levels looked at, and primary care may address it, urology may address it, whatever.
They might look at it.
I'll just say, if you do it, typical dosing for a male is, you know, injection intramuscularly once a week, because the half-life is 7 to 9 days. I find that it's better if you split that dose to 2 times a week, for sure, because that's going to give you more stability of your levels, and it avoids, you know, high hematocrits and hemoglobins or whatever. And I'll just say one point on that: when you're on testosterone as a man specifically, you are increasing that the testosterone is increasing that red blood cell production, which is going to give you the energy you need, but over time it can build up that hemoglobin and hematocrit. So you don't want to buy this stuff offline, okay? You've got to be managed appropriately.
You need to be monitoring yourself.
Yeah, you need to be monitoring yourself.
And working with a doctor if you...
Right, you don't need to just order it and do it, right? So you don't... Testosterone, you know, has gotten a bad rap before, and still does, because people abuse it, and it's usually not that, it's usually with other things.
But people abuse every other drug too, so it's not...
Right, testosterone is natural, it's naturally made in your body, you know, it can... I've seen it turn men's life around. When you have a low level and you are suffering from that, I have seen men who they're sleeping better now. They're not depressed. They have more energy. They're working out for the first time in years. I mean, it blows my mind the difference it makes. So, you know, men are not so really underserved. They may not necessarily be treated the best.
No, men can...
But they can easily get it if they want it.
They can go to a clinic.
They can go to a clinic.
There's plenty of clinics for men.
So women.
But they don't monitor other things though either.
No,
We know
well,
that.
that's true.
We can get into that later.
Yeah.
But.
So with that, women, you don't know if it's your hormones. You're like, well, is it? Because listen, we've talked about it before, but like vitamin D, iron, vitamin B, like all those things are super important, right? But if you are affected by your hormones, like I said, for a man, for a woman, I mean, yeah, sure, as we get older, we could have night sweats, hot flashes, this, that, and the third, but it can affect us sooner than that. We can be in our late 20s, early 30s, whatever, and our testosterone level is low, and that, can, reduce our energy. It can affect our mood, our brain function, all of that, our libido. People think, oh, I don't need testosterone, I don't want libido. Libido is the byproduct. You want to feel better. Testosterone in a man and a woman supports your metabolic health. It lets you be able to build that lean muscle a little bit better. It's good to keep your hormones in balance, right? So when a woman asks most providers, hey, will you check my levels? They're like, oh, you're good, you don't need that most of the time. And I'm just like, I don't really understand that, because our bodies naturally make testosterone. We make progesterone, we make estrogen, all those things. And
just in different ratios than men.
And a lot of providers, especially in systems, not, standalone is a little bit different, but they don't want to address those things. And I don't quite get it, because the first thing they'll do when, you're 14 years old or whatever, and you have heavy periods and they're painful, is they'll throw you on that synthetic birth control.
Which is synthetic hormones.
Synthetic hormones, that suppresses your hormones. It does a lot of other things. It leads to inflammation. It can lead to issues, honestly, to where you could even have depression and end up on an SSRI. I mean, I'm not trying to label it all bad, right?
No, but maybe, possibly, we're inducing as a society chemical imbalances by throwing everybody on a birth control.
Yeah, it usually
because it does
things.
Because it throws you're messing with your hormones when you're messing with a synthetic hormonal birth control. Mm-hmm. And I don't know, lo and behold, people have chemical imbalances, or they don't feel right because we're playing with those levels. It's a byproduct. It's a side effect. Yeah. We have to talk about that side effect, but nobody wants to talk about it. It's just like, no, it's totally normal to give people birth control.
I have many patients who have asked their provider to, check their hormones, or they're already on it, and then they go and tell them, oh, I'm feeling better, I'm doing this and doing that. And why are you doing testosterone? Like they're doing meth or cocaine or something. And I'm just like,
I know. This is heaven forbid you feel better. Heaven forbid. Heaven forbid it.
But I've seen women in my practice who have rheumatoid arthritis, and they have like bilateral hip pain or just all kind of different joint pain, and they needed, at the age they were and the symptoms they had and the lab levels they had, they needed testosterone, estrogen, and progesterone. And that full gamut of that usually just balances you so much better and supports your metabolic health, that not only do you feel good, but their joint pain went away. And I was like, oh my gosh. And then they were able to actually lose a little bit of weight that they were trying to lose, because it's like their body was in a more optimal state.
It's functioning as designed at that point.
They're feeling better. They're not hurting.
Right.
They're able to do the things they want to do. And I'm just like, you're replacing what's low with what the actual thing is, and I don't understand how that's bad.
It's it all goes back to performance enhancing, like in sports and things like that. And there's this stigma that if you take bioidentical hormones and they're equating it with abuse, right? If you balance your hormones to a more youthful level that's natural to the body with bioidentical forms, like so the testosterone, the estrogen, and the progesterone matches what your body produces, and you balance that, how is that hurting the body? How does that hurt the body? It doesn't hurt the body. It makes it function the way it's supposed to.
Right.
And so suddenly the depressive symptoms, like you said, you had go away.
Right.
Now, me personally, I didn't think I was depressed, but the difference between how I felt when my levels were below 100 and I went to a clinic and then I got them up to a normal level.
You are more assertive now, so I feel like it's better for you.
It is better.
I've seen, so people will be like, oh, roid rage, oh, this or that. And it's like,
No.
no. If it's done right, it just enhances who you naturally are.
Right. If you're a jerk and you take testosterone as a guy, you might turn into a little bit bigger jerk.
Yeah, you might have a little bit more road rage. But, like, you were always really laid back.
I always had road rage.
But now
Learn how to drive, people.
You're
Jeez.
still laid back, but you're more assertive.
Right.
I don't have to, and listen.
But that's important for a man.
When I say what I'm about to say, don't take it wrong. Because if you need an SSRI or any kind of like antidepressant, anti-anxiety, if you need any of that, please take it. That's fine. What I'm saying is, for me personally, I was able to come off of that. And I was on that from like 20 years old to 30-something years old. And I've been off for like 4 or 5 years now. Which is wonderful, right? That's great for me. And so, no, that's not. I don't expect that to be the norm.
But your state of mind, your state of mind now is better than when you were taking those drugs that were supposed to be making you feel better.
Right? Because we would listen. If I didn't take my pill for like 2 days, it would be like, "Can you take your happy pill?" And honestly, it's crazy because now, do I get a little anxious at times?
Yeah, but you don't.
Absolutely. Anxiety and depression is normal.
A normal part of life.
But to what level? You have to. I'll have a little bit here and there, but you have to be able.
But how
to
are you channeling it?
But the point is, if you give your body what it needs, and you whether that's vitamins and minerals, like we always talk about, or the hormones.
Yes.
You are going to be in a better suited position to be able to handle your life, be in a better mood,
right?
And just handle anything that comes your way, right? Things are still going to happen. You're still going to get upset sometimes. You're still going to have a day where you want to cry, maybe every blue moon. But I find those days much less.
But now. You take care of it's like this. This is the way I think about it. Some people need that stuff because they're not willing to fill in the gaps with it, make sure the nutrition is there. The first things that you should always do to me is make sure your nutrition is good, your sleep is good, that you're trying to manage your stress, that you're doing some physical activity, maybe some resistance training, going hiking, find a hobby, do something outside, go for walks. You got to be active and do things and channel some of that anxiety and stress. And if you're doing all those things, and you've been doing them for a while, and you still feel crazy, you should get your hormones checked. If your hormone levels are good, I don't know. I don't really believe in a true chemical imbalance per se, unless you have you're crazy bipolar. That's a chemical imbalance. There's levels to it. There's levels. Yeah. It's a spectrum.
Oh God, spectrum.
But I won't say anything about that.
Okay.
That's from a previous video. I think the chemical imbalance thing, a lot of times we're inducing the chemical imbalance because of our lifestyle.
Right.
We throw somebody on a hormonal birth control. Right. Our hormones get out of whack at that point. Now we're on an SSRI. Now you got all this chemical.
Let me tell you how many times I've seen my patients come in on hormonal birth control, and I test their labs, and their inflammatory markers are up, their hormones are depressed, and all these things because, that's
you're playing with the hormones.
And a lot of that's processed by the liver.
Right,
or whatever, so
right. Liver.
It's not necessarily, it won't always be true inflammation, but with the CRP elevating the way it does, there's a lot to it. But what I'm trying to say is, when that is increased, it does still increase your chance for developing the heart disease and all that stuff. So the point is,
it's not safe.
Yeah.
Long term, it's not safe.
Right. So all the numbers are inflated or whatever, and that's not good. And they have all these problems or whatever, and I'm like, well, if you're not worried about having a baby or whatever, and you're able to come off of it, let's if we're able, right? And a lot of times the ones that do, man, they end up feeling way better, and then as soon as I check their numbers again, they're down, and I'm just like, I don't make this stuff up.
It's in the blood work. We're saying this because you're seeing it in the blood work.
Right.
And
I see that they feel good.
And you can observe it in society. It's not like, oh, you don't have a study to show what you're like. I don't need a study to show me what I see.
Yeah.
And what we see in clinic, it's not rocket science. And you are now. Can I piggyback on what we've talked about and talk about how, like, they'll put like an older person on birth control to manage like premenopause?
We've got a couple minutes.
Oh, okay, all right. But like this is what was new to me. So like throwing an older person in their 30s or 40s on like hormonal birth control to manage perimenopause symptoms and stuff like that.
Depending on what the symptoms are, I understand why they do, but I think that at that point you're masking symptoms.
But that's my point. So it's like instead of giving somebody bioidentical estrogen, like with a cream or a patch, they're saying take this hormonal birth control, which is synthetic,
which increases
estrogen,
your risk of
which is associated with certain cancers and stroke, right?
Right.
So the medical system as a whole wants to throw women as, here's a pill to help you manage these symptoms, when you could just take bioidentical estrogen patch once a week or whatever. And progesterone and testosterone.
Yeah, depending on what it is. Like if it's like really, really heavy bleeding or whatever, progesterone may work, right?
I got you.
Okay, but here's the reason what. A lot of times they'll do synthetic progestin with a Mirena IUD, and they look at that, and I understand it's the lesser of the evils because it's only progestin and it's not the synthetic estrogen. So that strength of progestin will actually manage that heavy bleeding. So I do understand that. But my point is, could we not try the progesterone first and see if they respond? And if it's not strong enough, then see what I'm saying?
Right.
Versus just automatically assuming that they need.
Try the more natural bioidentical version before you're trying to go the synthetic version.
Everything I do, I try to do natural first before I go to any kind of, harsher thing or synthetic thing or whatever. But I do understand it. But what I don't agree with the synthetic estrogen progestin route. I do understand the Mirena.
Well, but for decades, the argument against hormone therapy was based on the fact that early on there was the synthetic estrogen that they were giving to people, and they associated it with cancers and all this stuff.
Yeah.
And they scared people away from taking hormonal therapies. Yeah. But then it's similar synthetic versions that are in the birth controls that they give out like M&Ms. Right. And I'm like, wait a minute. Exactly. But they hand out birth control like it ain't no problem, but heaven forbid you take hormone therapy.
If you do testosterone, progesterone, or estradiol, it's natural. It's like risk neutral or can even help.
What you're doing is natural. Yes, it's estradiol. Yeah. It's testosterone is already bioidentical, and progesterone is bioidentical. Yeah. So people say, well, is it bioidentical hormones? Well, the only thing you really need to worry about is the estrogen version, which is you want estradiol.
You want estradiol. You do not want the synthetic.
And you don't want like progestin if you can avoid it. But progesterone capsules is what you usually get.
You could consider like a progestin only mini pill if you needed birth control, or whatever, because some women don't want an IUD, which I don't want anything in my body, but that's just me.
Yeah, I got it.
But anyway, the point
I don't want it in my body either.
I guess let's wrap this up and just say, as far as the hormone therapy, it's definitely something to be researched even more on women because we are underserved or whatever, and then there's a better way for men too. Men should be managed. I
don't think it needs to be researched more.
Women. Well, I mean, if they want to.
No, I think anybody in clinics know it's the same. You just need to balance it the same.
Yeah, I mean,
we know how to do it in men. Men and women have the same freaking hormones.
Yeah, our numbers
in different ratios.
Different. Like,
we
it's
just different.
Need a lot less.
Yeah, you don't need to take.
So we know what it's going to do. Like, I mean, heck. I can tell you just off of my patients what is probably going to do.
If you know how to practice medicine and look at it, like, okay, if I give you this dose, it's going to get your level to about this. That's what you're doing. But the rest of the
I'm
system
just
doesn't want to do
saying, when
that.
I say research more, I say from the standpoint of.
Well, I'm saying we don't need medical research
No, but-
papers to tell us what to do.
But what I'm saying is the way our system is set up, it needs to be researched more so that way
It needs to be eliminated.
people or whatever will be able to get it if they want to use their insurance, and insurance will pay for it.
You need the FDA to approve the
Because
same
insurance is not
things
really
for men.
gonna approve testosterone for a woman necessarily.
They should.
Right,
That's right. That's
so-
the problem.
That's
so-
what I'm saying.
Yeah, I agree.
But-
I agree. But
but
yeah,
no,
the system is developed in a way where it prevents women from getting the same level of care in that scenario as a man.
Right. So, if you know, like he said, if you're doing the basics, you're trying to focus on a nutrient-dense diet, you're sleeping, you're moving, you're trying to manage your stress levels.
Yeah.
You've had your, let's say you've had your blood work looked at. You know that you're not deficient in any vitamins, minerals, or whatever, but it's your hormones. Then maybe that's when you have the talk with your provider about, hey, would you benefit from, hormone replacement?
The thing is,
So-
they have not had those things checked at your regular provider. Those things have not been checked at your regular provider, I assure you.
No, I mean, because I check a
not
really,
fully.
really full panel. Like the hormone panel is very comprehensive. It's not like just one or two numbers. Like it's a lot because you have testosterone and estrogen precursor hormones. Then you have the things that they turn into in the body. Okay, so there's a lot to think about when you're talking about hormone therapy. So you got to go to somebody who knows all that, who understands all that, and sees that in practice,
And works with it.
and does it day in, day out, and lives and breathes it. And so
Fully is looking at
Yeah.
all the thyroid markers to look at the
everything.
Yeah.
So anyway, if you guys have any questions on hormone therapy, whether that's in men or women or it's something else completely different, just leave us a comment and we'll be happy to discuss it in a future video. But that's it for today.